Hi, I'm Sarah, and our 5-week community placement is based at the Kimberley Population Health Unit in Broome, Western Australia on Yawuru country. The Western Australian Country Health Service, or WACS, is governed by the Western Australia Government Department of Health. WACS is divided into the 7 regions of country Western Australia. The Kimberley is at the top of Western Australia. Kimberley Health is divided into 4 health services. These include hospital services, aged care services, mental health services, and community and public health services. KPHU sits under the Community and Public Health Services sector. Within KPHU, there are allied health, community health, disease control, and health promotion teams. The supervisor for our project, Jenna, is the nutritionist at KPHU, which lies within the health promotion sector. Jenna is responsible to the Public Health Manager and Director within KPHU. Her role is centred around food security and community development. She runs projects and activities to improve nutrition and health throughout the Kimberley. These include cooking programs, education sessions, car park feed, and community gardens. Jenna's been discussing local food systems for several years throughout her professional and volunteer work. Our local food systems project is aimed to contribute to a long-term goal to achieve food security in remote communities in the Kimberley. The Western Kimberley had a thriving local food system in the 1990s when growers could sell at local markets and direct supply their produce to smaller supermarket chains in town. Then the major supermarkets arrived. This resulted in local growers no longer being able to direct supply their produce. This has resulted in most small growers ceasing to exist as they were no longer able to remain viable. This has meant the remote community stores in the Kimberley order their produce from Perth and consequently have poor quality, high priced produce, which is unaffordable for most. Our local food system project aims to look specifically at how government services can support local food systems. Our project is centred around institutions such as hospitals, prisons, schools, and aged care services within the Western Kimberley region. As these institutions provide food to people every day, they are frequent and reliable consumers. So the pitch of the overarching program is that these government institutions can support the revival of local food systems by procuring all of their fresh food from local producers. The revival of these food systems within the Kimberley will hopefully allow for delivery of fresh produce direct to remote communities, which will be higher quality, more nutritious, and more affordable. Our project involves us communicating with key stakeholders along the supply chain to gain their opinions on the proposed policy. Our interviews will be conducted with dietitians, kitchen staff, food service managers, canteen managers, local growers, and truck drivers. Our aim is to determine if they believe the idea will be possible, cost-effective, and worthwhile. The program management cycle will be used throughout the program. This includes a needs assessment, planning, implementation, and evaluation. Our needs assessment involves us collating past information collected over many years by our supervisor and conducting our own literature review on the health outcomes of individuals within the Kimberley, specifically focusing on the benefits of implementing farm to institution policies and the impact of local fresh produce being available to remote communities. Planning our project involved us to create goals, objectives, and strategies of the program, which are documented here. The implementation of our project will involve us creating a list of who we'll interview, developing our interview questions, conducting these interviews, and then combining our data into a draft document for future publication. Process evaluation would be conducted by reviewing the structure and methods of our interviews, if we interviewed the right people and gathered all the information we needed. We would also evaluate the experience of the interviewees who we spoke with and whether or not they had a positive experience working with us. One framework which underpins our project is the social determinants of health. The social determinants of health have been devised from evidence gathered in the ways in which social, economic, political, and cultural conditions create health inequalities. Agriculture and food production is one of the social determinants of health, which is a major influencing factor that impacts on food security and availability of fresh, affordable produce to the communities within the Kimberley. By considering these determinants of health, we're better able to develop a more effective project. Here is our proposed timeline of what we're aiming to have completed by the end of each week to keep our project on track. As we're away all of the last week working on an additional school garden project in Frog Hollow, we've condensed our project into a 4-week timeline. Other additional activities we'll be involved with throughout our project include assisting with the car park feed, possible school cooking classes, and contributing research to a climate change inquiry for Jenna. Thanks for listening.